Let me get my presentation up and everything. Okay, got that up. Welcome, welcome, welcome to our support group tonight. I'm just going to open my questions box so I can see everyone. Phyllis says, what is the best exercise? Ooh, I love it. Starting off with a question already. Linda says, hi. As always, I love starting off our sessions with sharing where you're from. So feel free to say hi from wherever you are. I know we have some people in different countries, other people are in freezing cold temperatures, others are in warm temperatures. So let us know where you are joining from in the little chat comments question box. I'm not sure exactly what terminology it uses for you. And we did just start with the questions. Phyllis says, what is the best exercise or activity to improve balance? Phyllis, so what I would suggest is after this session that we have tonight, I believe tomorrow morning-ish, you will be emailed by Jennifer from MS Visa News. And we had an entire session, 2 sessions actually, a Q&A and then an actual presentation on balance. So all of the recordings are listed in there. And just as a note for all of you guys, if you're on this call, you are already registered, so you will receive an email from Jennifer as well immediately after, or sorry, not immediately after, likely tomorrow, with all of the recordings that we've had so far, as well as with a link that you can sign up for my takeaways from each session. So make sure to click on that link if you haven't already. But let's see where everyone's from. Ooh, Mary Lucia from California, Dana from Michigan, Deborah from Minnesota, Dodge Center, Minnesota. Phyllis Rockaway. Ooh, Anne is from Los Angeles. Welcome. Tamara is in South Carolina. Atlanta, Georgia. Ooh, North Carolina. Angela's from North Carolina, just outside of Raleigh. I'm actually flying early tomorrow morning to North Carolina. My twin sister lives there, and she's moving back to Western New York, so we're going to make the drive together. Linda is from West Palm Beach, Florida. Angela from, oh, I already said Angela. Dion, New Jersey, California. Quinetta, Rhonda, Delisa, Pam, Nicole, Mary Lou, Linda, Vishal, Renita, Ann, Marshall, Shelly, Janet. Yay, awesome. Thanks, guys. Kathy from Illinois. Oh, we got a Canada for the win. Diana, South Carolina. Awesome. Well, keep them coming in. I love knowing where you guys are from. So thank you for sharing that with me. As you guys know, last session, we talked all about sensation, and sensation is a really hot topic because there is not a whole lot that we can do for it. There are some strategies, and we talked all about them last time. So what we're going to do tonight is a Q&A about sensory-based topics. So I'm going to share my presentation with you again. We spent the whole time last time going through it, so I'm just going to breeze through it quickly. If you do want to watch the full presentation, again, look for Jennifer's email tomorrow. That's going to have the YouTube video posted where you can watch the full things, but also today's main point is a Q&A, especially for those of you guys that were already on last time. So if you have questions, drop them in the comments. I can see that as my presentation is going, so I can look for your questions as we're going. So actually, before I share my presentation, if anyone has any questions about sensory issues or exercises right off the bat, just let me know. All right, so we have one question. I think you mentioned magnetic pulsing as a possible treatment for unpleasant sensations, but it wasn't on the takeaway handout. The reason that's not on the takeaway handout is because it's not a super common strategy. And when we get to that slide, you'll see the other options. So that's not, it's one that they have researched slightly enough to say, like, yeah, this might be effective, but it's not one that's done as frequent. So that's why I didn't really make a big point about it. Good question. Okay, so as you guys think of questions, I'm going to just share my presentation and hop right in. So I'm going to share my screen. All right, oops, hold on one second. All right, view. Full screen, okay. And as always, I never ever want to forget thanking our supporters. So Bristol Myers Squibb and Sanofi Genzyme are our big supporters for this support group. They are the reason that this can happen along with MS Use and News. So thank you, thank you, thank you to all of them. And we talked about sensation specifically in multiple sclerosis. As you all likely know, there are tons of different sensations. This is just the first several that I thought of, but we could probably collectively list about 50 probably different sensations. So just opening up your chat box to see if anything else comes through. So this is going to be a big eye-opening thing when you mention to your doctors any of these words: burning, pins and needles, numbness, tingling, crawling, tightness, shock, stabbing, shooting, radiating. Ones that aren't on here is like bugs are walking on you, or water dripping, or hot or cold. All of these things are sensory issues, and it's important to note that we have different nerves. Some are motor and responsible for muscle action, and others are sensory nerves that are responsible for sensations. So any of these words or other types of sensations that you feel are geared towards the sensory nerve that has the damage. Going on here. And then you can also be hypersensitive, where when your skin is touched or something happens, your skin overreacts. And then you can also have hyposensitivity, which is less of a response. This is really dangerous if you have hyposensitivity and are also using a hot pack or a cold pack or something like that, because you likely can't tell if it's burning you, if it's been on for too long. And that can happen with hot packs and cold packs. Another thing we talked about was pain, as well as triggers and different locations in your body. These sensations can happen really anywhere. It can be on one side or both sides. It can be lower body versus upper body, or MS hug. It can really be anywhere. We talked about the different types of sensations and pain. And again, these are just 4 of many definitions that we have. So allodynia is where something of a light touch that shouldn't be uncomfortable does cause pain. Paresthesia is one that you likely have heard often. This is more of an annoying, unusual sensation, and it could be something like numbness that can be triggered and just be very spontaneous also at the same time. Dysesthesia is a more intense, painful feeling when it is spontaneous all the time. And then neuralgia is another one that's extra common in MS, and this is more of the shock-like pain. You might have heard of neuralgia specifically with the phrase trigeminal neuralgia, and that's the face type of neuralgia where you have shock-like pain. I do see some questions coming in, so I'm going to get out of my presentation for a second. Stop sharing there. Okay, back to me. So questions. So let's see. Kathy, any experience? Oh yeah, okay. So Kathy says any experience with Lhermitz and the range of sensations it can cause. So for those of you that don't know, Lhermitz disease is when you bend your neck down. So there's neck flexion. And when you do that, you get intense shock-like symptoms and pain that goes all throughout your whole body. And for some people, it goes through their whole body. For other people, it's just the neck. Other people, it shoots all the way down their spine. They can feel it in their arms. So it's different for everyone, but it is not comfortable. It is usually very painful. And it specifically when you flex your neck. For other people, it can include flexing your back at the same time. So that flexion movement is what causes that. And that is a sensory issue as well. To my knowledge, there isn't a whole lot of treatment for that. Temporarily, it's doing exercises that are extension based. So maybe something like this, but more importantly, more neutral based. So more of a chin tuck where you're just tucking your chins. You're trying to keep your spine in the proper alignment to avoid that flexion. Good question, Kathy. Lots of questions coming in. I apologize if I miss any, but I'm gonna keep do my best to try to not to. Catherine, is there anything you can do for clonus? So clonus is actually more of a motor nerve issue. So again, we're motor versus sensory. Sensory are all those symptoms that we've been talking about just over the last few minutes. Motor is more of weakness or difficulty reaching for something or walking, like a muscle mobility function movement type of thing. So clonus, if you pretend this is my knee, this is my heel, these are my toes, oftentimes clonus happens if you go into ankle dorsiflexion, so you lift your toes, oops, really quick. So the test for that, hopefully your neurologist has done this, if not your physical therapist, but will grab your toes and quickly force you into flexion, and I don't know if you can tell what I'm doing, but it quickly shakes like that. And it gets this pulsing like symptom. So the best strategy for clonus, as simple as this might sound, is to avoid those positions. It can even happen sometimes if you're just sitting right now. For those of you who have clonus, you'll know what I'm talking about. If you're just sitting right now and move your one leg or both just back, so you're moving your feet back so your knee is bending even more. For some people, it doesn't require that quick movement. Just any time that your ankle is flexed too much, you'll get that clonus, that shaking. And when your foot's on the ground, it often looks like your knee is bopping up and down. So that's what clonus is. And the best thing to do for that is to avoid that position. And that usually means that you're changing the way that you sit, as well as changing the way that you walk, because walking does require you to lift your toes. So there are strategies for that, depending on how clonus affects you. For some people with clonus, it doesn't affect them too much. They just have to avoid being in the position. For other people, they feel it every time they walk or every time they sit down. Let's see, I can't see who said this. Marshall, try CBD massage oil on feet for pain sensations. Good to know. Yeah, so if you guys have anything, we did this last time, but if you have anything that has worked for you for sensory changes, then definitely let us know. I'll try to read them all out loud. Shelly, I've heard of many MSers with neuropathy on feet bottom. I've had for 8 years, no diabetes. It is most likely my MS. Any thoughts on this? Yes, I do have thoughts on that, Shelly. So that makes things really challenging, as I'm sure you're aware. If you have sensory changes, so you use the word neuropathy, if you have neuropathy on the bottom of your feet, that can be tricky because you often can't tell where your feet are in space. So you don't know if your toe touched the carpet and therefore you might fall or trip. Or you can't tell if your toe is touching first before your heel. You can't tell if your feet are too close together or super wide apart. Usually it's too close together. So there are some strategies that you can use for that. Again, we talked about the sensory strategies last time, and I'll review those in a second. But even something as like looking down when you're walking, just slightly in front of your feet so that you can see your feet out of your peripheral vision, that is usually something that us physical therapists would recommend, because if you can't feel it, that's a safety hazard. It's a safety risk, a fall risk, because you don't know where your feet are. And we need to know, we need to have that feedback in order to balance and in order to walk. In terms of the sensory issue, or not issue, sensory exercise, that would be a perfect time to use the strategy we talked about last time, where you put a bunch of rice in a bowl, or I actually like to use a pail, like a bucket, put a bunch of rice in it, put your foot in it, move your toes around, move your foot around. You're trying to get more sensation back and desensitize that area. Good question. Tamra, or is it Tamara? I think it's Tamara. Are there any exercises or stretches that will help with pain in the hip that goes all the way down to the foot? I get that pain on my right side. It tends to get worse with walking. Nothing I do seems to help with stretching. So this is an interesting question, and I can't give an exact answer because I don't see you right in front of me and I would need more questions answered. However, it brings up the point of pain. And is pain more of a sensory versus motor? And it can be both. Pain can be a sensory symptom. In fact, pain is on a sensory nerve, but pain can also be caused from weakness in muscles, and therefore other muscles are overcompensating. So the best thing that I can say for Tamara is sometimes pain that shoots all the way down the leg is caused from the nerves that are being squeezed from tight muscles. So stretching your hip muscles can often be a good way to reduce pain sensations from tight muscles. Phil, are you familiar with the company Med Rhythms work with improving gait with music coupled with walking? I'm not familiar with that specific company, but I am familiar with using music and metronomes, something with a beat, to help improve walking. I've actually used that a few times with some of my clients when we were working together in person. I have several clients who go to music therapy and they actually work on their walking in music therapy. So yeah, Phil, I'm glad you brought that up. If you guys haven't heard of that before, try setting a beat for, and sometimes it is just a metronome, it's just a beat, and you can choose the pace, and it's one step it's one step per beat that you hear, or it can be a music or a song that you enjoy, and to go to the beat of the song. But I'm not familiar with that. Med Rhythms is the company that he mentioned, if anyone wanted to look that up. Elizabeth, what about non-infectious, non-allergic sneezing? I have heard of paroxysms. I have heard of people who sneeze, and whether that's related to MS or not, I'm not sure, but people with MS who do have these sneezing fits almost, and unfortunately don't have too much to say about that. I don't know. I personally haven't seen anything, and maybe you guys have, so correct me if you have seen something else, but I haven't seen any research that correlates sneezing to multiple sclerosis, but I have seen some clients have sneezing issues. So I'm sorry, I can't really say too much on that. Shelly is asking, would neuralgia, I think that's actually I'm not sure what the question is, would neuralgia, I think she meant neuralgia, be a synonym for spasms? Not necessarily. Neuralgia, if that's the word that you meant to type, I think it is. Neuralgia is more of a shock-like symptom, whereas spasms is more of a cramping type symptom. Shelly again says, I get spasms only in the right side of my rear end. When they occur, they are paralyzing. I literally have to stop in my tracks. So that's where the piriformis muscle is, or yeah, the piriformis muscle. And sometimes when that muscle is tight, often from standing or walking, it can cause radiating type symptoms. So pain first, and maybe it travels down the leg. One of my favorite, again, stretches, I forgot Tamara maybe who asked the question earlier, kind of sounds like it could be the same thing. One of my favorite stretches for the hip, I don't know if you guys know it, but it's also called the piriformis stretch if you wanted to look it up, but it's a figure 4 stretch where you're sitting up tall and you cross one knee over the other one, and then hinge forward if you want more of a stretch. And it stretches that rear end hip area out nicely. Andrea, trigeminal neuralgia, facial pain, sensory exercises, question mark. Apologies if this has been asked. So for trigeminal neuralgia, I don't know if this is correct or not, but I personally consider that as a different classification of sensory issues, which actually I didn't mention trigeminal neuralgia during our last sensory presentation for that reason. So I don't know that the sensory exercises that we reviewed last time would be helpful for trigeminal neuralgia. Part of me is thinking there's no harm to doing the exercises. It's not like you're going to hurt yourself, so you could give it a try and see if it helps. But the sensory exercises that we mentioned last time have been more researched for sensory changes, more in like the hand, the arm, the foot, the lower leg, things like that. But you can always try it, see what happens, see if it does help. Patty, great question. So she's asking, is shaking or trembling on one arm associated with MS? It absolutely can be. I've had some clients who have shaking or trembling on one arm, one leg, or I've also had whole body shaking and trembling. And this one is, I think it's a little bit tricky to talk about because in my mind, it could be both sensory and motor nerve issues, but I believe it's mostly the motor. Based on what I've seen, and this one is a really tricky one for me to wrap my head around because I think it does sit in both categories, but from most of what I've researched, it more so sits in the motor realm, where it's the actual muscle that's tightening then releasing, tightening then releasing, tightening then releasing, and causing that trembling type movement. So it's more of the muscle versus the sensory. Mary Lou, a burning sensation on left side of shin. I had shingles for years ago, face and scalp. Is there a possibility that causes the sensation or nerve damage, or could it be a combination of shingles and MS? You know, MS is one of those diseases where there are so many other diseases that mimic it, which is why I'm sure some of you on here were maybe misdiagnosed for a while, because there's so many other things that present similarly. Also, aging, like as we age, our walking becomes a little bit worse, our balance becomes a little bit worse, our vision becomes a little bit worse, things don't move as well. All of those are also symptoms of MS. So it's really tricky to say, and I can't answer this question definitively of is it shingles and MS or just MS or just shingles. It's really hard to say. Sorry, I lost my way. Okay, Jennifer. Oh, you guys are long questions tonight. This over here, Jennifer. I usually feel the burning sensation on my back when I lay down on my bed to go to sleep, and it can feel like my back is on fire. Is there anything I can do before bedtime to minimize this burning sensation? So Jennifer, I would say try a bunch of things. You know, if it's positional, that's one thing. So if it's every time you lay on your back, and this is something that you could try out. If you lay on your back at noon, do you also feel that burning sensation, or at 5 p.m. or 11 a.m. or 10 a.m.? Is it all the time you're laying on your back and therefore it's the position, or is it specifically at this time at night, and is it right away? Or I don't know if you mentioned this, if it's right away or if it's after you're in that position for a while. Again, if it's positional and every time you're in that position for that length of time it happens, no matter what time of day, then you want to be thinking more about changing the position that you sleep. And there's lots of strategies for that. But if it's purely just before bed and you want to try out some things, yeah, maybe try out stretching your back muscles a little bit. I would maybe like your back muscles and maybe your hip muscles, leg muscles. Just try stretching beforehand. See if that makes a difference. You could try cooling your core temperature down a bit. See if that makes a difference. So yeah, you could definitely try a couple things. See if anything changes. Renee, what kind of CBD oil? So this might be for a question for, I forgot who said it, but someone above recommended CBD oil. And there's so many different types out there. So if that person is still on, let us know what type of CBD oil you are using. And I would suggest too, like do your research before. There are so many different companies out there now. I will say I had a patient who was supposed to be given, what was it? I believe it was an oil with CBD, and CBD oil is supposed to only have trace amounts of THC. And she actually was, so she was supposed to be given that, but she was actually given a 1-to-1 ratio of CBD and THC, which, as you may or may not know, that's the type of high that people would get from THC. So she didn't know that she was given that type, and she ended up having hallucinations. It was a very scary experience for her. So do your research when you're looking for CBD oils. Dana, any tips for MS hug relief? Great question, Dana. MS hug, for those of you that might not know, is when you get that band tight sensation around your core. And the best thing that I can say is, and this doesn't work for everyone, but it does work for some people, is movement. So sometimes it's just sitting down and just moving your arms, twisting if you can without pain, just light twisting, stretching your arms overhead. And I'm doing this pretty quick. You could go much slower. But just getting your body moving has been an effective strategy for some people who have the MS hug. So that's definitely something that you could try if you haven't already. Delisa, acupuncture was a temporary fix. Good to know. Andrea, for itching and creepy crawlies around my eyes and face, I take 1 or 2 Benadryl. Good to know. Thank you for sharing. Myrna, I'm in a 6-week study with Naboso insoles as a treatment for neuropathy. The insoles have small bumps. Very cool. Delisa, I have pain in my calves. Daily leg massager helps a lot. Awesome. That's really great. Thank you for sharing. Amelia says, my arms and legs often ache like I have the missing part of this. My arms and legs often ache like I have something. I assume this is MS related. I can take Tylenol and it helps, but is this something else? Is there something else you can recommend? You know, anytime someone says, sorry, I'm a little confused by the question. I'm just making sure I'm understanding it. Anytime someone has any type of muscle ache, an anti-inflammatory could be beneficial. If you're looking for non-medicinal ways, stretching. Oftentimes when muscles ache, no matter where they are, neck muscles, arm muscles, leg, you know, wherever they are, if a muscle is aching, it usually means that it's either tight or overworked. So if it's tight, that's when stretching that muscle would feel really nice. If it's overworked, that means there's weakness somewhere else. And so that muscle that is tight and has that ache is getting an ache because it's overworking. So figuring out which muscle is weak and therefore causing that muscle to overwork would be extremely helpful, which is what PTs are there for. Myrna, okay, I think this is related to this study that Myrna just said she's part of. Dr. Emily Spleichel is running it. And this is in quotes, we are kicking off a 6-week pilot study with 50 participants who have foot numbness causing loss of balance and fear of falling. Our goal with the results is to lay the groundwork for our FDA Class 2 approval for neuropathy so we can get our neuro insoles covered by insurance for these patients. Julia, not sure if this is related to sensory, but how do you combat the tightness and pain that goes along with lymphedema in the lower extremities on leg that is more affected with MS? So it does kind of go along with that because lymphedema is swelling, and the more swelling there is, the more tightness and the more pinched nerves. Anytime there's muscle tightness or swelling, there's less area for mobility of nerves to move the way they want to move. And that there's just so much crammed in there that everything gets pinched. When muscles get pinched, it can kind of feel like a cramp, so you want to stretch it out. But when nerves get pinched, that's when you get some of those sensory issues. So and lymphedema is a whole separate beast. Again, we didn't mention this on the last call, again, for that reason. It's a completely separate beast. But there are specific types of lymphedema massages. Typically, there's many, but the one that I'm aware of is, and this was the leg you said, right? Lower extremities. Typically, you want to start low and massage up. So if you imagine like a foot right here with an ankle and then leg, like knee, hip, someone standing right here, it's go from the foot to the ankle to the lower leg and up, and then let go. And then back down at the bottom and you're pushing up and then let go. So you're constantly pushing up towards your heart to get it flowing back throughout your body instead of pooling at the bottom. So I hope that's helpful. Oh, so many questions, love it. Catherine, from last time, I was trying to ask if Botox helped. So Botox I think, let me actually go to that, or I don't know where that slide is right now, but Botox does help for some people. There isn't anything where I can say, this helps for everyone that I know who has multiple sclerosis sensory issues, but Botox is something that people try, and it has been helpful for some people. So if you haven't tried Botox, it's something you could talk to your neurologist about. Your neurologist would likely be the best person to ask about that because they know you and your symptoms. Everyone on this call, excuse me, my voice cracked. Everyone on this call who has sensory issues likely presents differently. That's part of the gem that is multiple sclerosis. But it can be caused from different reasons too. So definitely something to talk to your neurologist about if you haven't already. Marshall, is stretching recommended to reduce rigidity or use medications like baclofen? Awesome question. So I actually think next session is on stretching. Let me see. Next is general symptom management, and then is stretching at home. So Marshall and anyone else who is interested in this topic, definitely make sure you pay attention to that one. But yeah, again, I'm a physical therapist, so I'm all about doing physical things in addition to medication. So baclofen is a very common drug that is used for spasticity and rigidity. When it comes to rigidity, which if that's truly the term that you mean, which rigidity, if you guys were on last time, is the fourth stage of the spectrum of spasticity. So there's stage 1, where you're tight, but your muscles can move through the full range. Then there's type 2, where they're tight and you can move, it's hard, but you can get to about half the range, but that's it. And then there's type 3, where again, it's hard and you can't even get to halfway, it's even less. And then there's 4, which is rigid. And even the strongest person in the entire world would not be able to move the muscle, the joint, whatever it is, that's rigid, because your body is just locked in that position. So if you truly mean that rigidity, research shows that stretching is not that effective. But if you have any of the other 3 levels of spasticity, then research shows that prolonged stretching is helpful. Prolonged meaning, with several minutes, even maybe up to 5 or 10 minutes versus the typical 30 seconds that we're told. Elizabeth, my calves have become atrophied, but calf raises, etc., causes spasms. Any recommendations? So calf raises is a pretty intense exercise. I think even for people who don't have MS, maybe that's just me who thinks that, but that's, for those of you that don't know, that's the exercise where you're standing and you come up on your tippy toes and then down, then up and down. So another way that you can modify calf raises, I'm assuming we're all sitting right now. If you're sitting, you can put your feet on the ground and just lift your heels up and down. Much less weight. When you're standing, your full body weight is through your feet. So you're lifting your whole body weight. But when you're sitting and lifting up your heels, it's not even 50%. It's just really the weight of your legs. So that's a modified way to do it. And then even more modified, as you're lying down in bed or on a couch, or just sitting with your legs reclined, or your body reclined and your legs up. Again, if this is my knee, this is my heel, these are my toes, just practice pointing your toes down and then relax. Point them down and then relax. So just point, hold, relax. And that's another way to work your calf muscles in a modified way. Let's see, Philly, I'm confused about desensitization. I can't purposely create the sensation. Right, so I don't remember if you were on last time or not, but there are 2 different types of sensory issues. Sometimes you can make it happen. It's like if I touch my water bottle, my hand goes numb from touching the water bottle, something like that. Whereas other times you can't create it, it just happens on its own. This is what we talked about last time, where for that type where you can't create it, the desensitization exercises are not that helpful, and that's typically the type of sensory symptom that is controlled more by the medications. But sorry, I was going to go on to the next question. But I mean, you could still try it and see if it helps. Again, the sensory issues, the desensitization exercises are so great because there's no negative side effect. You're not going to hurt yourself. You know, it either helps or it doesn't help. So it's still something you could try, but from what I found in research, that is more of the type that is controlled via the medications. Catherine, will Botox injections help address an itchy head? Someone last time had said they tried a shampoo, but now I think they said it, I can't remember if they said it did or didn't work. I'm not sure if Botox injections would help an itchy head. To my knowledge, Botox is more for tightness and that sensory of issue of tightness and spasms. So itchiness, I'm not sure. Julio, can meralgia paresthetica be associated with MS? I'm actually not sure what that is. Meralgia. I'm trying to think. If you could explain what that is, I might be able to answer a little bit clearer. Michika, the prone exercise is very hard to do. I can't lift my leg off the floor. How can I get any benefit from the exercise? I'm not sure which prone exercise you're referring to. So for those of you that don't know, prone means you're laying on your stomach. So I'm not sure which exercise you're doing. I'm sorry. Robert. Dr. Holly, I'm Bob from New Jersey. Welcome, Bob. Thanks for joining. My right leg is severely affected from my MS and I have trouble getting in and out of my car. Do you have any tips? Yes, because this is more of the sensory thing, I'm just going to refer you to the very first, no, I can't remember which one it was, but go when you get Jennifer's email for the recap of the presentation and all of the YouTube videos, watch the one on functional exercise. That's the one that goes over exactly how to improve things like that. Also, I've mentioned this in the past, but for those of you who on here, I'm not sure how many, that are part of the Missing Link, which is my online MS wellness program, there's a whole topic in there that's called task-specific exercises for tasks like this, like getting into and out of your car, getting in and out of bed, in and out of your bathtub, getting up off the ground, getting down to the ground, these activities and tasks that we have to do throughout the day. And they're broken down into exactly which exercises to do, as well as how to do that full movement. Myrna, chiropractic adjustment of the ribs. Oh, awesome. It helps the MS hug. So I forgot, whoever asked about the MS hug, Myrna said that for her, chiropractic adjustment helped of the ribs specifically. Another doctor who talked about CBD oils and medical marijuana told us to never get those items from gas stations. Always go to a reputable shop or company. Absolutely. I would 100% agree with that. You really have to be careful. And even the people at dispensaries, sometimes they don't know much. Like they might say that they are trained with medical marijuana and uses for specific things like multiple sclerosis, but you really want to question where their expertise is from and make sure you're getting the right thing. Can you help me this is from Janet. Can you help me understand how localized therapies help symptoms when the cause is coming from the brain or spinal cord? Yes, I will do my best. So when the issue is coming from the brain or spinal cord, it extends. So like, let's say, you know, the brain here, there's a part here that's causing the sensory issue and it travels down my arm causing numbness. So the issue is here, but it stems all the way down here. And the way that this works, if I can try my best to explain this, is, what do I have around me? I happen to have this thread. I'm a sewer, for those of you that didn't know, around me. So if this, touching my hand here, normally increases my sensations, what's happening is I'm touching it and that message is going all the way back up to my head, my brain, and it's saying, whoa, something's happening that I don't like it. The longer that you do that, and this is different for everyone, it might be a couple minutes or it might be several days of trying it, but the whole idea of desensitization is that over time, your hand says to yourself, if we could give your hand a voice for a second, it would say, okay, Janet, that's okay now. I'm used to that now. That doesn't bother me as much. And the numbness lessens. And again, that's going all the way up to your brain. Your brain is the one making the ultimate decision. So every time we're rubbing, we're touching, we're patting, it's constant message from your hand to your brain, hand to your brain, hand to your brain. And so eventually your brain is saying, oh, okay, that doesn't bother me so much. So it's all related. It's not what you feel in your hand is a direct result of what your brain is telling yourself it's feeling. I hope I'm explaining. Let me know, Janet, if that makes sense or not. But it's not two separate things. It's not like doing something down here doesn't affect my brain. It's keep in mind that pathway goes the whole way from the hand. I'm just using the hand as an issue, all the way to the brain or all the way to the spinal cord, wherever that's stemming from. Cindy, is lymphedema more common with Parkinson's? Just curious. Not that I'm aware of. I haven't done as much research on Parkinson's, so I could be wrong, but not that I've heard. Next one, Myrna. I have a lesion at T4 causing T4 syndrome. What can I do to get relief? Ooh, this is a tough one. You know, when it comes to something that there isn't a lot of different, what's the word I'm looking for? Not therapies, but different, we'll use the word therapies for lack of a better word. When it comes to that and you're just like, I don't know what to do. What do I do to try to help this symptom? The best thing is just try different things that you know don't bother you that much. Like if stretching feels good, try stretching. Try stretching your neck, try stretching your shoulders, try movement, moving around. If that doesn't change anything, try hot versus cold, cooling your core temperature down, try strengthening some muscles. So when it comes to something like that, where it's just it can be really broad, just try a bunch of different things. And I know that's not a specific answer, but at that point, to me, it's more trial and error. I hope that's helpful. Quinetta, my walking is so bad along with my balance. I see a PT on Wednesday. I hope they can help or let me know if I need to go to the hospital. Just confused about my walking, not sure what to do. Quinetta, watch the very first webinar that we did for this support group presentation. Again, it will be emailed to you tomorrow. The very first one was on walking and balance. Definitely watch that before you go to your appointment. Any advice on upper body stretches? My lower neck, upper shoulders are stiff using the cane. Yes. Again, we have a whole nother section on stretches. If we have time at the end, I'll come back to this one. But we were gonna have a whole webinar on stretching. So stay tuned for that one. It's a painful numbness on my thigh. I wear loose clothing, tends to help. Stephen, a leg lifter can help pull your leg into the car. Yes, oh my gosh, do I have it here? I own a leg lifter so that I could demonstrate. I just moved literally over the weekend, so all my stuff isn't in the normal spot. But a leg lifter it can be so helpful. You can use that for lifting your leg to get into the car, lifting your leg to get into or out of bed. Yes, thank you, Stephen, for mentioning that. Because there are a lot of exercises that you can do. And because I'm a physical therapist, that's where my mind goes first, is what exercise can I give you to help with your weakness? But there also comes a time where you're building that strength, and so you don't have it yet. And there are a lot of different tools like the leg lifter that you can use to help yourself out. So you can use both exercises, but also don't forget about all these amazing tools that are out there. Quinetta, the missing link sounds good. I would like to join this group. I have fallen in my tub and downstairs and was there for hours until my spouse got home. So for those of you that are interested in the missing link, my website is missinglink.com. It's spelled MSING link.com. If you go there, and then click on the missing link, there's actually a behind the scenes video that you can watch to look into the program and see if it would be a good fit for you or not. So you'll be able to look at that. You'll be able to see much more information. And if you are interested in signing up, there's a link that you can sign up there too. So missinglink.com, MSING link is the website for that. Michika, is your prone leg lift exercise in your core program that I can't lift my leg? Oh, okay. How can I do it to benefit from it? So there's an exercise, and this is more strengthening, not sensory, but there is an exercise where you can lay on your stomach and lift one leg up, and it's to strengthen your glutes and your low back. There's an alternate position is to do it laying on your side, or even to do it in a standing position as well. When you're doing it laying on the ground, that actually is the hardest version because gravity is pushing you down, and you're trying to lift your leg up against gravity. So those are some other options. Marshall, okay, so Marshall's responding about the CBD products. Make sure you can obtain access to their lab/test results. This is an unregulated industry, but access to that test facilities and results keeps them honest. Great suggestion. Thank you for mentioning that. Janet, that's helpful, thanks. How would stretching help though? I forgot the first part of this question. That's helpful. How would stretching help? Can I scroll up quickly and see? Oh, maybe can you help me understand how localized therapy and symptoms when the cause is coming from? So stretching, let me go back to this one. I don't want to lose my spot. Stretching is helpful if the issue is coming from tight muscles pinching the nerves. And to be honest, we never know. There's so many different reasons that can cause sensory issues. And the only way to really know is to get an EMG test or try some of these things out. So stretching, if stretching helps, and you have to be stretching the right muscles, so it depends where your sensations are. But if you're stretching the right muscles, that's going to loosen up the muscle. And when the muscle's looser, there's less tension on the nerve. Keep in mind, I did this demonstration last time, but which hand do I want to use? Keep in mind that if, let's say this is a muscle right now, and this is a nerve, every nerve runs through muscles. So if the muscle is tight, it's squeezing it. And it's almost like a pinched nerve at that point. So we've all heard of that phrase, I'm sure, of a pinched nerve that can cause numbness, tingling, burning, pins and needles. That can be caused from just a tight muscle and then the nerve is just trapped in there. So if you can stretch that muscle and loosen it, that would then release the pinched and tightness on that nerve. So at that point, if that was the question that you were referring to about going back to the brain, the stretching helps for issues that don't necessarily stem from the brain, but stem from the muscle itself. I hope that answers the question. And so many questions coming in, I'm getting confused on who's asking which ones. Bruce, what do you do about intentional tremors? Intentional tremors are definitely tricky. One thing that I have done with my clients in the past is focus on, for those of you that don't know, for intentional tremors, again, I have my water bottle right here. So let's say my water bottle is sitting right here. Can I put it there? Yes. And let's say I'm going to reach for it. As soon as you're going to reach for something, an intentional tremor is usually you're going to reach for something, and that's when your hand starts shaking. And sometimes it's so bad you can't even grab it. And maybe you're over here now instead of directly in alignment with what you're shooting for. So some of the exercises that I've given my clients in the past for intentional tremors is to be intentional about something, still reach for something, but have it be really big. For example, what do I have around here? All right, I have 3 different things. This, if you wanted to pick up my spool of thread, that's going to be pretty hard. That's small. So the tremor is going to be pretty intense if you go for a small item. Next up, I have my phone. It's a little bit bigger. It might not be as bad, but the tremors could still be present. Next up, this is even bigger. So you could try to reach for something like that. Those are the main things I have around here. But it could even be reaching, I like to just use things that are in my normal environment, which is why I'm looking around. But it could even be reaching for the desk that's in front of you, anywhere on the desk. And then you could maybe narrow it down to the handle of the desk. And then maybe narrow it down to a fine point on the handle. So just start, I hope that makes sense, but start really big and broad. You know, again, I just happen to have this exercise step right here. So just an example, maybe at first I just try to touch the step in general, and you try to touch it. And keep doing that. It's very similar to the desensitization exercises where keep doing it until you get a little bit better at it. And for some people, it might take a couple of days. For others, a couple of weeks, a couple of months. It can be a very long time, but make it easy for yourself. And then once I get good at that, just touching the step, then maybe my tremor isn't as bad. So then I shoot specifically for somewhere in the green part. And then once that hopefully gets a little bit better, shoot for a specific letter. So you're starting off with something that's bigger and therefore easier, and your brain doesn't have to work as hard for you to get to that spot. Steven says, a good emergency tool to communicate with someone else is to carry a phone with you when you are alone. I have my phone on a lanyard around my neck. Devices like Alexa can make a call for you if you are in voice range. Tips from my experience. Great one. Thank you for sharing. Lisa says, I love your business label. Thank you. Holly says, I am very flexible. Something in my eye. Holly, I'm very flexible. Stretching my legs makes walking harder. Should I do less stretching? Okay, I'm glad you're mentioning this, Holly, because I've been talking about stretching a lot tonight. Everyone is different. If stretching doesn't feel good for you, I would suggest not stretching. Or, you know, for the first thing I always suggest is change the way that you're doing it. So again, we have a whole conversation on stretching coming up in a few weeks. So Holly, I hope you can join that. But if stretching bothers you and makes walking harder, change the way that you're stretching. If you're currently stretching and holding for 30 seconds several times, maybe change it to dynamic stretching, which is just a few seconds, but more like 20 or 30 repetitions, or change the muscles that you're stretching. So change it up in some way. And if you've modified it and it still bothers you, then I would say, find something else. Don't do it. You don't want to do anything that makes walking harder or causes pain or anything like that. And that's true for all exercises as well. So we just specifically said it for stretching, but if there's a specific movement or exercise that's really hard for you to do, modify it. Or if it causes discomfort or pain, modify it. If that's still not comfortable, modify it even more. If that's still not comfortable, just don't do it. There's tons of other things out there that we can try. And then someone asked, what's the link to your web again? So I don't know if you guys can see what I'm typing. I'll type it in here again. So it's missinglink.com, but it's spelled MS as in multiple sclerosis. So MSING link.com. I don't know. Can you guys see? I don't know. I just pressed it. I typed it and then pressed send to all. So hopefully you guys can see that. I'm not sure what you can see on your end. Okay, Kathy says she can see it. Good. We've got about 5 minutes left. That was the end of the question so far. Any other questions? Let's see over here. Look over here in my email, see if we got any. Okay, and Deborah, Michka. Okay, so a bunch of people are saying they can see it. Good. Cindy, thank you so much for sharing all of this extremely valuable information. Much appreciated. You're welcome, Cindy. Again, I know I mentioned this last time, but sensation is such a hard topic to talk about because there's not always something that you can do. You know, there are those medicinal treatment options as well as the sensory exercises, but for some people, neither of those help. It's one of those realms where we don't know as much about in terms of therapy. We know why it's happening, but in terms of therapy and things that you can do to help reduce it, that's where there's more of the unknown. But I purposely wanted to make this presentation just so I could share what I do know. I do not have all of the answers, but I just wanted to share with you what I do know because sometimes even just this information that we've reviewed, people weren't aware of. Julia, what is pneumatic compression? Pneumatic compression, that sounds so familiar. I'm blanking on the definition. New of pneumatic, it's spelled PNEU, is usually lung related, I believe. So maybe it's more of like that tightness, or it could be kind of similar to the MS hug. I'm not sure. I'd have to look that one up to give you a better answer. Michka, you mentioned functional exercises. Was there a link? Yes. So one, again, I'm getting confused on all the different presentations that we've had so far, but again, look at the email that Jennifer will send you next or tomorrow for there was one specifically called strengthening and functional exercises. We are going to be extending, hopefully, fingers crossed, for another 6 rounds. We were going to do, we've been doing these once a month, and we were going to stop after 6 months, but we've gotten such great feedback that we're going to continue with them. And that is going to be another topic that we talk about, because I don't know if you guys were on for that, the strengthening and functional exercise one. We like went over the time both times during the Q&A and the actual presentation, because there's just so much content to go over and so many great questions. So that will definitely be something we talk about again, but it is something we talked about within this past support group. So look for that video that Jennifer from MS Visa News will send you. Ushka, you've been such a great help. Awesome. Kanita, D plus stretch cause cranny best heat. I think there's some mistyping in this one. I'm trying to make out what it might be. Stretch cause. Kanita, if you could retype your question, that would be great. Julia, it was on a site discussing, oh, lymphedema. Yeah, I'm not sure. Okay, Julia says pneumatic compression. Yeah, I'm still not sure about that one. Kanita, I'm waiting. Kanita says something about cramping, heat or cold. I'm trying to make sense of this question. If cramping, I mean, let me first say, any symptom that you have for multiple sclerosis can worsen with heat, or if you have heat intolerance, it will worsen with heat or your core temperature rising. If you have cold intolerance, it will worsen with cold temperatures or your core temperature lowering. So if cramping is one of the symptoms that you have, that can be caused from heat and cold intolerance. I hope that answers the question. Kanata, thank you. Marguerite or Peggy, I really enjoy the missing link. Going to continue doing it. Thank you, Dr. Gretchen. Yay, awesome. I'm glad you're enjoying it, Peggy. Lisa, Dr. Gretchen, excellent presentation as usual. Thank you. You're welcome. Elizabeth. Okay, so Elizabeth may have looked this up. She says pneumatic compression is alternating pulsing compression for treatment of lymphedema. Okay, gotcha. I was thinking it was more of a symptom. Alternating pulsing compression for treatment. I can see how that would be helpful for lymphedema, for any type of swelling. Thank you for looking that up, Elizabeth. Nicole, thank you. Looking forward to chair yoga. Yeah, and for those of you guys that don't know, I do live exercise classes every Wednesday on Zoom. They're not in person, but on Zoom. Tomorrow is chair yoga. Kanita, stretching causes cramps equals best use heat or cold. Oh, okay, I see what the question is. So stretching causes cramps, you might be stretching too much. So my first suggestion would be don't go into that much of a stretch and see if that helps. But if any stretching causes muscle cramping, usually heat is best for cramps. But this is another situation where what research says is heat to relax your muscles and then ice to reduce inflammation. But some people do ice instead of heat for muscle cramps and it feels better. Other people use heat for reducing inflammation and that helps. So it's different for everyone, but typically research shows that heat is best for relaxing muscles. Thanks so much for another great presentation. You're welcome, Janet. Holly, I love your presentations. I'm so glad you guys are liking them. Julia, can diuretics make lymphedema worse? I need to touch up on my lymphedema. Since it's not a common symptom in multiple sclerosis, I'm not sure. I'm sorry. Thanks so much for providing this space. You're welcome. I'm having major hip problems now with my MS. What can I do to help that? My pelvis rotates and that causes one leg longer than the other. So this is from Veronica. Great question, Veronica. We are just over time. And also that's more of that to me sounds like more of a strengthening issue. We're going to have a topic in our future rounds, hopefully if we're able to have them, on MS-specific physical therapy versus regular PT. Both are helpful, and this sounds like a situation where regular PT might be helpful exercises. Someone says, thank you. How do we get to your Zoom classes on Wednesday? What is the best way to do that? You know, if you are registered for my takeaways, again, if you're not registered, Jennifer will send you an email tomorrow with all of the past presentations, as well as the link to sign up for my takeaways. And I basically just write down my top 4 or 5 takeaways from each presentation. And so if you are registered for that, I will include the link in the takeaways to sign up for that class or to get more information on that. All right, let me see if there's any other pressing questions. It's 8:02 or just over. Thanks from the Great White North. You're welcome, Michael. Diuretics, very limited help except spiralitone. Okay, and then thank you, Dr. Holly, so much for your info. Okay, I'm going to end it here. Awesome, awesome, awesome questions, you guys. These are all great questions. I hope you have found some answers that you can maybe try to help reduce any type of sensory issues. And if you're not having sensory issues, hopefully it was just extra knowledge for you. Again, as always, thank you to our sponsors, supporters, Bristol Myers Squibb, Sanofi Genzyme, and MS Views and News, for helping me host this. And our next call is going to be in 2 weeks, and our topic is going to be general symptom management. So these are kind of all of the other symptoms that aren't related to sensation, fatigue, things that we've had other presentations on. So thank you again for joining. I hope you have a great evening. Another question, do we have to sign up? No, Shelly's asked, do we have to sign up each time for more takeaways? No. If you signed up once for the takeaways, that's all you need to do. You don't need to sign up every time you're on the takeaway list. Good question. All right, guys, have a great evening, and I'll see you in 2 weeks. Bye, everyone.